confirmed cases, up 13 cases in the last 24 hours. 271 are active, 304 have recovered, and we had the 4 deaths that we've reported all along. We've now performed 27,370 tests. I also want to emphasize that our current rate of cases per 100,000 is stable at 38.6 per 100,000. This is still well above the threshold set by the state of California. Sonoma County, so Sonoma County must get down to 25 cases or less per 100,000 over a 2-week period to be able to safely move to the next phase of reopening. However, we do meet the metric for the percentage positive of our total tests positive. We are hovering at around 2 to 3%. And as we're under 8%, that is a good signal for us. As a result of having very stable epidemiology of the 38 to 40 per 100,000 cases over the past 2 weeks, we had decided that if we stay in this ballpark and we don't see any big differences in the next couple of days, that as I stated 2 weeks ago, we'll be able to move on to opening some other sectors. So you may ask, what sectors are we considering opening? We are planning to move towards faith-based services of up to 100 persons indoor, or 25% of a facility's capacity, whichever is less, with all the mitigation measures that we've discussed. For example, facial coverings and the social or physical distancing, and to ensure that nobody is ill attend services. I would still recommend that people who are over age 65 or those with underlying conditions be careful before attending these sorts of in-person services. The other thing we're considering that we'll move forward with is all store retail that is small retail businesses for in-store shopping with measures, as we discussed previously. And the third thing that we are considering is the barbershops and hair salons. Now, this is limited to hair, does not include nail salons, facials, etc. So barbershops and hair salons for hair, specifically with mitigation measures in place. These are 3 areas that we're considering opening as of this weekend, if all goes well and we don't see any increases or other warning signs that would limit us at this time. I also want to state that we have new data on SoCo emergency and the COVID dashboard. You know, as of May 31st, we have data on employment sectors where positive cases have been identified across Sonoma County. I do want to be really clear in stating that the majority of our transmission has not occurred in workplaces. So although this is a good amount of data showing where persons with COVID in our community work, it doesn't mean the transmission or spread of COVID is happening in these places. So the data can be found under the employment section in the Sonoma County COVID-19 case data tab. As of today, we're also opening up further Sonoma County parks and coastal beaches for recreation activities. We're going back to normal opening in terms of hours. However, we still fully recommend that people keep social distancing in place, wear a face covering, and do abide by the regular hygiene practices while at our parks and coastal beaches. So I'm not, the community question that we have is, I'm not sure where to go to be tested if I have no symptoms. If you are a healthcare worker, first responder, or essential worker, you can be tested at the Sonoma County Department lab in Santa Rosa without having any symptoms. Appointments can be scheduled by calling 707-565-4467. If you're not part of one of these groups, you can make an appointment in either Petaluma or Santa Rosa through OptumServe. Appointments can be made by visiting lhi.care/COVID testing. All tests are free from either public health or from OptumServe, which is our state-run 2 service locations in Santa Rosa and Petaluma. Thank you for joining me today. Take care of yourselves and your family, and we'll talk again soon.